All right, let's dive in. Today, we're going to demystify one of the most common, but also one of the most profoundly misunderstood conditions out there, depression. And right off the bat, we need to be clear. This is so much more than just a bad mood. It's a complex condition that can literally reshape a person's entire reality.
And to really get to the heart of what this feels like, just listen to this. It's a quote from a patient back in the 80s, and it just nails a key difference. Grief, when you lose someone, that's sadness. But depression, that's sadness plus this crushing, overwhelming feeling of worthlessness. It's a total shift in how you see your place in the world.
So that brings us to the big question, right? What exactly is this state we call depression? How does it manage to completely warp our experience of the world? Well, that's what we're here to do, to peel back the layers, from what it feels like to how it changes our thoughts, all the way down to what's happening in the brain. Okay, so first up, what does depression actually feel like? It gets mistaken for just being really sad all the time. But the reality is just so much bigger and more pervasive than that.
There's a key clinical term here that's incredibly helpful, and it's called anhedonia. It's so powerful because it's not about the presence of sadness, it's about the absence of joy. Think of it like a kind of emotional anesthesia. All the things that used to light you up, that you used to love, they just feel gray, meaningless.
And this quote right here, it just captures that feeling perfectly. It's not just a lack of interest, it's an active emptiness. A void that opens up where all that pleasure and excitement used to be. And honestly, for a lot of people, this is one of the most painful and debilitating parts of the whole thing.
So how does this all get formalized into an actual diagnosis? Well, doctors use a specific set of criteria. To be diagnosed with major depressive disorder, you have to be experiencing 5 or more of these symptoms you see on the screen for at least a 2-week period. And when you look at that list, it becomes crystal clear this isn't just a mood. It can mess with your sleep, your appetite, your energy levels, your ability to focus. It touches everything.
Okay, so let's build on that. We've talked about the raw feelings. Now let's shift to the cognitive patterns, the actual thought processes that fuel depression. It's almost like being forced to look at the world through a distorted lens, one that makes everything seem darker.
A psychologist named Albert Ellis came up with a really brilliant way to understand this called the ABC model. He said it's not the activating event, missing the bus, that directly causes the feeling. No, it's the irrational belief you have about it, the story you tell yourself, like the bus drivers hate me, that leads to the emotional consequence of feeling defeated.
And building on that, psychiatrist Aaron Beck identified these common thinking traps he called cognitive distortions. They're like faulty mental habits that can become totally automatic. Take magnification, for instance. You make one small mistake at work and your brain blows it up into this absolute catastrophe that proves you're a failure. At the same time, it minimizes all your past successes. It's like a mental filter that's designed to only let the negative stuff get through.
Now this brings us to a really crucial and often scary topic, thoughts about self-harm. And it is absolutely vital to understand that not all of these thoughts are the same. An intrusive thought is often like a false alarm from your brain, that horrible what-if thought that pops into your head and makes you anxious precisely because you do not want it to happen. An impulsive thought, though, is different. It often comes from a deep, desperate desire to just make an unbearable pain stop. One is an anxious warning, the other is a distress signal.
So, we've covered the feelings and the thoughts. Now we're going to zoom in even deeper, right into the neurochemistry of the brain itself. For decades, the main story you probably heard was the chemical imbalance theory. The more formal name for this is the monoamine hypothesis. The basic idea is that depression is caused by a shortage of key chemical messengers in the brain. You've probably heard of serotonin, for example. Now we know today the full picture is way more complicated than that, but this hypothesis was a huge deal, and it's still really useful for understanding how a lot of modern treatments actually work.
Think of it like this. Your brain cells pass messages back and forth using these chemicals across a tiny little gap. The theory goes that in depression, there's something like a tiny vacuum cleaner that sucks those messages back up way too quickly before the signal can get through. So what do many antidepressants do? They essentially block that vacuum, leaving more of those messengers hanging around in the gap to get their job done.
And that basic mechanism is behind several different classes of medication. You've got the most common ones, SSRIs, which just focus on serotonin. Then there are SNRIs, which hit both serotonin and norepinephrine. These can sometimes help with chronic pain too. And then there are older types, like TCAs and MAOIs. They can be really effective, but they tend to have more side effects, so they're usually not the first thing a doctor will try.
So, when you look at this complex mix of feelings, thoughts, and brain chemistry, it's pretty clear there's no single magic bullet. And that brings us to the really hopeful part, the many different and effective pathways to healing.
Let me start with a really powerful number, 81%. According to one major study, that was the effectiveness rate of cognitive behavioral therapy, or CBT, after 36 weeks. But here's what's so incredible about that number. It was the exact same effectiveness rate as medication. Therapy can be just as powerful.
And this is exactly why the best approach is often a holistic one. Treatment isn't just one thing. It's usually a combination of things. Talk therapy, lifestyle changes like getting regular exercise, and yeah, for some people, medication. It's all about nourishing the entire system, not just treating one part.
But here's the thing. Even with all these effective treatments available, listen to this staggering statistic. It takes the average person with a mental illness over 10 years to finally ask for help, a decade. And that delay is so often fueled by the shame and the stigma and the simple misunderstanding that still surrounds this stuff. It's why just talking about it openly is so incredibly important.
So I'll leave you with a final question, one that kind of reframes this whole conversation. What if depression isn't just a bug in our brain software that we need to fix? What if it's also a signal? A profound and, yes, incredibly painful signal that something deep in our lives, our values, maybe even our society needs our urgent attention. It's something to think about.